Good morning, everyone. My today's topic is minimum criteria for reporting adverse drug reaction or adverse event. Adverse event is untoward medical occurrence in a patient or a clinical investigation of a subject when administer a pharmaceutical product, or it does not necessary to cause having a causal relationship between drug and ADR. Then an adverse event is unfavorable and unintended sign or laboratory finding or a symptom of a medicinal product. Then adverse drug reaction. Adverse drug reaction is pre-approval or experience with a new medicinal product or a new usage of a drug or therapeutic dose or not established. All noxious and unintended responses to a medicinal product are related to any drug administered considered as adverse drug reaction. A response of a drug which is noxious, unintended, or which occurs due to dose when dose normally used for a prophylaxis, diagnosis, and therapy of a disease for a modification of physiological function known as adverse drug reaction. Then serious adverse event or adverse drug reaction is during the clinical investigation. Adverse drug reaction occur which is suspected to the medicinal product or related to the adverse drug reaction might be significant or enough to lead the important changes in the way of the medicinal product developed. Then therefore the special medical administrative criteria of the acceptance of adverse drug reaction is when the reporting time frames for the fatal or life-threatening or unexpected ADRs are 7 calendar days. For the serious or life-threatening ADRs, for all serious and unexpected ADRs, the time frame is 15 days, and expedited reporting and it is minimum criteria for expedited reporting. Minimum criteria for reporting is information for final description and evaluation of the case report not be available within the required time frames for reporting the adverse drug reaction, and the regulatory authorities and initial report should be submitted within the prescribed time as following. Minimum criteria are met, then identifiable patient, identifiable medicinal product, identifiable reporting source, and at least one adverse event, and outcomes of adverse event, identifying serious and unexpected ADR and for which the clinical investigation cases there are reasonable suspected causal relationship, and follow-up information should be actively sought and submitted to the available authority. And then the Sion's Form 1 is widely accepted form for reporting of adverse drug reaction for the expedited reporting of ADR. And however, the matter what or the form or format, it is important for the certain information and data elements are in tabular form or narrative presentation. Then the listing of attachment or addresses of data elements and are regarded to the desirable. All types are not available or at the time of expedited reporting, or the effort should be made to obtain them. Then the managing therapy for the cases when the sponsor and investigator are blinded or individual patient treated. Then the blind study is performed for the occurrence of adverse drug reaction or adverse event on the patient whether the code is assigned or not. It check. Thank you.